Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now let's focus on what is known as the nephrotic syndrome. So this nephrotic syndrome, what is the primary pathology, is that there is a damage and dysfunction of the glomerular filtration barrier. So GF barrier is the one which is affected. And there's a significant leakage of the plasma proteins without the much glomerular inflammation. So there's leak in the plasma proteins. There's a leak in plasma protein and without much glomerular inflammation. So there's not much of glomerular inflammation is not present. So the GF barrier is defective and the glomerular inflammation is not much seen, and there's a leak in the there's a leak in the plasma protein. So what is the principal site of the glomerular injury here? The principal site, it includes a visceral epithelial cell. So it involves a visceral epithelial cell. So visceral epithelial cell is nothing but it includes a podocyte. Next, let's look at some important clinical features. So the important clinical features is that, what are the hallmarks? It includes a heavy proteinuria. There is a heavy proteinuria. So by heavy proteinuria, we refer to the 3.5 gram. So the 3.5 gram in 24 hours, or the urine protein creatinine ratio greater than 3. So this ratio is greater than 3. There is heavy proteinuria. Next is there is hypoalbuminemia. The hypoalbuminemia, and there is also presence of edema. Then comes the lipiduria as well as the hyperlipidemia. Next is there is microscopic hematuria. There is hypertension as well as hypercoagulability. Next, let's look at some associated glomerular pathology. So all this is with respect to the nephrotic syndrome. So the associated glomerular pathology is that there is a minimal change disease. So it can be primary or secondary. Next is the focal segmental glomerulosclerosis. So this is again primary and secondary. Then comes, so these both are primary and secondary. Next is the membranous nephropathy. So this is also the primary and secondary. Then comes the diabetic nephropathy as well as the amyloidosis. Diabetic nephropathy, amyloidosis. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.